Well, this month is Ehlers-Danlos Syndrome Awareness Month. It's a connective tissue disorder with no cure. Dr. Rob's in the house to give us details on how you can help those suffering from this painful condition. And this is Andrea. She's joining us today, and I understand that you do live with it. We're going to talk to you in just a moment, but first I want to go ahead and start with you, Dr. Rob, just to kind of give us a breakdown of exactly what this is.
Yeah, absolutely. It's not a common disease. It's one that many people have never heard of, yet there are literally thousands of people around the United States that suffer daily from EDS, or Ehlers-Danlos Syndrome, which is a chronic pain syndrome. And what it is, it's a genetic defect in the collagen. And collagen is so important because it's what gives the joints and the skin and the tissues and the organs and the vascular structures all their formation and their rigidity. And without it, it makes everything really elastic and stretchy, and you can have all kinds of problems. And the biggest thing is chronic pain from subluxation of the joints, the hypermobile joints, the tissue that wants to pull, it's really stretchy. They can get easy bruising, poor wound healing, have chronic fatigue, deal with anxiousness, depression, all kinds of symptoms. And it varies every day for every patient suffering from EDS. And Andrea can tell us a lot about that.
Yeah. Absolutely. If you can tell us, obviously we see a laundry list of the different symptoms that Dr. Rob is just mentioning, but he mentioned pain as well, and that's something that you have to live with day in and day out. Mm-hmm. What's it like?
Well, first of all, Dr. Rob, that was a great explanation of Ehlers-Danlos. I appreciate it. Daily living with Ehlers-Danlos is difficult most days, not as difficult some days. I get a lot of migraines and visual changes, chronic fatigue, as he mentioned. A lot of people with Ehlers-Danlos will sleep for 5 days almost, 18, 20 hours a day, and then for the next 2 weeks they'll be up for 20 hours a day and maybe sleep for 4. So that's a big problem. It causes all kinds of brain fog, so you're confused and you forget things, and we lose a lot of friends because of that. Because we'll forget to show up somewhere, and we do lose friends that way. It is becoming more and more known. A lot more doctors are becoming more familiar with it, so that makes things a little bit easier just because we have a place to go now. Migraines are terrible. Like you said, chronic pain. There are things we can do to help the pain. There are certain exercises that we can do to lessen the pain. There are things we can do to strengthen up the joints, around the joints. We do have loose ligaments, so the joints are always going to be unstable, but we can strengthen up around them.
Well, the sad thing is, there is no real cure at this point, but there are things that you guys can do. Now, there are a lot of resources. We have about 10 seconds left. Dr. Rob, if you could be so kind as to just kind of point people in the right direction if they're dealing with something similar to Andrea.
Absolutely. If you feel that you have this, bring it to the attention of your physician and say, hey, I think I have EDS. Let's take a look at this. But people out there suffering from EDS can find help at chronicpainpartners.com, the Ehlers-Danlos.com, and It's Our Time, which is on Twitter. So there's all kinds of help out there for people that have EDS, that are suffering from it, and that think they may have it. Say something to your doctor so they can start exploring what the possibilities are.
And Dr. Rob, you're always a great resource as well. We can always find you at the website right there at the bottom of your screen, ReNueHealth.com. It's always a pleasure having you on the show. It was very nice meeting you.
Nice to meet you.